If you've been diagnosed of kidney failure, or your kidneys is having a little issue, and or you're on dialysis, or you want to maintain a good kidneys, then you should really watch this video. Okay, so I'll be basically talking about diet on chronic kidney failure, and also what to eat if you're having issues already on your kidneys. Okay, and you, for those that are on dialysis and for those that are not yet on dialysis, but it's, you've been told that okay, you have kidney issues and you will soon be on dialysis, but you're not on dialysis yet. So these diets and these things I'll tell you will help you, you know, make you, the chances of you having like prolong the chances before you start dialysis. For instance, if you're to have dialysis in 1 year or in 2 years, if you do these things, it will really prolong, give you a lot of chances. Okay, and this video now will also be based on your elevated glomerular filtration rate. I will explain. It depends on the way your kidney is working, the amount, the way it's able to filter you know, the dirt, the food, and all of those things. So it's based on how your kidney, the level of your kidney function. Okay, so this is why this is a very important video. So if you're on dialysis, you've been diagnosed of kidney failure but not yet on dialysis, and you want to keep your kidneys healthy, this video is for you. So listen attentively. Now let's get to it. My name is Nurse Merit and I'm a nephrology nurse. Okay, so I've not really told most people about this. I dialyze and kidney is my specialty. So let's get to it. Number one thing is protein. Now, in protein, there is protein restriction. Restricting protein depends on what stage you are. If your glomerular filtration rate is less than 60, you will restrict your protein. Okay, this will help you to, you know, reduce the amount of ammonia in your body, urea, nitrogen in your body, and make your kidney rest a little. So you have to restrict your protein. I'm not asking you not to take protein, okay? And you also need to remember, you need to also, you hand in hand with your gynecologist, with your nephrologist and your nephrology dietitian. So but if you've been diagnosed of kidney failure and you're not yet on dialysis, and your your filtration rate is, you ask your doctor these things, is less than 60, you will restrict protein. Okay, but not so much. You can go for foods that are not so you know, like, you know, so high in protein and doesn't really stress your kidney, like fish, okay, snail, lean meat, okay, than going for high food like chicken, red meat. No, they are so high. Even if you eat chicken and, you know, but let it be like a piece in a day. Okay, this will really give your kidney leverage of resting and, you know, reducing the amount of blood urea, nitrogen, you know, in your body. Okay, now this is for people that has been diagnosed of kidney failure but not yet on dialysis and their glomerular filtration rate is less than 60. Now, if you're not on dialysis and you just want to protect your kidneys, I've made a video. Just always try to locate the videos I've made about kidneys and stuff. Just go, you see CKD on kidney on dialysis. Okay, you will see videos about kidney there. Just limit the way you take protein. I'm not asking you to, generally limit the way you take protein. You know, don't take it so much. Still eat like fish, you know, let it be on a normal quantity. Don't eat so much every time. No, it's gives your kidney much stress when you consume lots of meat and lots of protein. Okay, so now if you are now on dialysis, this is very important. Please, we advise that you you do not limit your protein intake. Yes, rather you have to some plant-based protein, a little, but never, you won't, you will eat protein very, it will even help you become healthy, because dialysis is clearing the protein. And this also depends on how many times you do your dialysis and the adequacy of your dialysis. Now I'm going to make a video of how to have an adequate dialysis, how you know you're not having an adequate dialysis. Okay, so if you're having an adequate dialysis, especially, protein is good for you. If you're on dialysis, it will make you not to lose weight, and even improve your health. If you're on dialysis, I see people don't eat protein because when they were in the stage of that's early stage where they've not started dialysis, of course the doctor will tell them this thing I'm telling you to limit protein. But now that you're on dialysis, you need to eat protein. Okay, so you need to eat protein now that you're on dialysis. Now that is it for protein. Number 2 is salt intake. Whether you're on dialysis or not, as long as you want to maintain your kidneys, you want to don't stress your kidneys, you need to limit salt intake, okay, to at least 2 grams in a day, and not more than at least 1.5 grams in a day, and not more than 2 grams in a day. I've made a video about that. That is about teaspoon, not a tablespoon, teaspoon. Okay, so when you if you're on dialysis, if you're not on dialysis, anyhow, just limit, because when you eat lots of protein, it increases your high blood pressure. Okay, because it increases your high blood pressure, and those that are on dialysis, it makes you gain a lot of water. Okay, because it draws water to you, so you also see your legs swelling and all of those things. I think I've made a video about how to reduce water intake on dialysis, how to reduce your leg from swollen and big if you're on dialysis, all of those videos. Okay, so limit salt intake. It will help you, especially if you're hypertensive. Please, everybody needs to remove salt intake. And how do you limit salt intake? Reading labels. Anything you're buying, make sure you read your labels very well. Try to check if it is more than 1.5 gram, leave it. Okay, salt intake, and try to eat fresh food, cooked food. Now this will now help you to know and know the amount of salt you yourself you're putting than the ones that has already been prepared. So you see, salt has a very big role to play, whether you're on dialysis, you have been diagnosed, or you are a normal person trying to protect your kidneys. Now the next thing is potassium. For people on dialysis, okay, you also need to limit a little your potassium intake. Not limiting actually, but you need to be aware of the food that are high in potassium. Now if you're having hyperkalemia, which is high potassium, you need to limit your potassium intake, and especially those that are taking drugs that are drawing in potassium for them. Okay, so now I know, because potassium, when it's in its excess, it makes your heart beat faster, and it can block the heart. So now if you are on even people that has been diagnosed of kidney failure but not yet on dialysis, okay, you don't need to limit your potassium if your glomerular filtration rate is not less than 30. Okay, so if you're not on dialysis yet, okay, you don't really need to limit your potassium. This now depends on the amount of way your kidney is working. This is why I'm always telling you that you need to check with your nephrologist. Ask them this question. It is your right. Ask them. So your kidney might be functioning, okay, removing them to a certain level, okay, but you just need to be aware of the food that are high in potassium. Now if you're not on dialysis, no problem for you, and your kidney is working, you've not been diagnosed of anything, your kidney works, no problem. Now these are the food that have high potassium for those on dialysis: bananas, nuts, all these nuts like almond nuts, kale, oranges, avocado, pears, cabbage, and leafy green vegetables. Just be aware of this food, and when you've been told that your potassium is high, then you know you need to limit it, and make sure you do your EUCR at least every month. Especially for people in Africa, they don't do this. This is high potassium can kill so fast, so you need to be aware. And dialysis also help you, balance these things. So just, discuss your options with your doctor. Number 4 is phosphorus. Yes, phosphorus. If you are not on dialysis, if you've not been diagnosed of kidney failure or kidney injury and your kidneys are okay, you don't have high phosphorus level, you've not been diagnosed of hyper, phosphoремia, like you've not been diagnosed of high phosphorus, okay, you don't need to limit your phosphorus level, no problem, you don't need to. But people that are on dialysis and their glomerular filtration rate is now less than 30, and they are on stage 4, stage 5, please, you will have to limit your phosphorus intake. I'll tell you food that are high in phosphorus, because high phosphorus for you is not good. If you're on dialysis, your kidney has deteriorated so bad, because it can cause bone problems for you. In fact, you will be taking, your doctor will prescribe a phosphorus binder for you, so that the phosphorus wouldn't be going inside your blood, be absorbed inside your blood. Okay, so you need to reduce your phosphorus intake, maybe to like 800 milligram a day. I will tell you the foods that are high in phosphorus, like chocolate, dark chocolate, dark drinks, dark beverage drinks, like cola products, those food are high in phosphorus. Milk, yogurt. I'm not asking you now, I know this seems horrible, but you just need to be careful and be aware, and then be taking your drugs. You take these drugs with food, okay? So for people that have been diagnosed of kidney failure, but their glomerular filtration rate is still less than 60, and they just need to be aware of this phosphorus, and a little bit, limit it to a little bit, to like 800, okay, a little, okay. And always check, do your kidney test, always check your estimated glomerular filtration rate, and be aware, okay. So now the next one is water intake. For diet on CKD is water intake. Now let's get to it. Water intake, well, if you're not, remember we're dealing with 3 categories: people that want their kidneys to be okay, they don't have kidney issues; people that have been diagnosed of kidney failure but they are not yet on dialysis, their dialysis is still prolonged; and then people with kidney failure that are now on dialysis, people that are now currently on dialysis. So I need you to be aware. So now, water intake. If you're not on dialysis, you don't have any problems with your kidneys, you're okay, please make sure you take a lot of water. The amount of water you should take is maybe 2 to 3 liters, 4 liters, depending on your activity and depending on where you are, okay, and what you're doing, okay. When you work out, you tend to take more. When I work out, I tend to take like 5 liters in a day maximum. But when I don't work out, maybe normally I'll just take maybe 2.5, okay, or to 3, depending. So it depends, but make sure you don't take less than 2.5 liters a day. Less than 2.5 liters a day. So water is very good and optimal for you. It will help you, hydrate your kidneys, prevent you from having kidney failure in the future, okay. Most people are dehydrated, and this is very bad for you. Now, how would you know you're dehydrated? Sometimes when you see that your urine is a little bit dark yellow. Your urine is supposed to be yellow but light, okay. So what you just need to do is to drink water. You see it, your urine will start changing. So do not allow your urine to become that dark yellow where it is dehydrated. Now I made a video on causes of foamy urine, you can watch the video here on my YouTube, just locate it. So try to drink lots of water. You have it at the back of your mind that you need to take water whether you're thirsty or not. They are good for your kidneys. Do not allow yourself to be thirsty, because most of the times you might not, especially in the cold weathers, you might not even really be thirsty. So just drink water. Now, for people that are been diagnosed of kidney failure and not on dialysis, you also need to take water, but depending on your condition. Now, if you have congestive heart failure, you might need to restrict your water intake. So this is why I always keep telling you to consult with your doctor what you should do. Okay, now in regards to water intake, you need to consult also with your doctor if you're having an underlying condition. Okay, so you just need to take water. Now, people that have AKI, a lot of water will be giving them, sometimes infusion, to see if they can challenge the kidney to come back. Okay, so you also need to take water. Now the next one is people on dialysis. If you're on dialysis, you have to restrict your water intake. It's compulsory. Now, when you don't restrict, especially if you don't urinate at all, especially if you don't have residual kidney function, if you don't limit your water intake, you have continuous respiratory issues. You have shortness of breath. Water will be filled in your lungs, because the water has to look for a lot of places to go, because the kidney can't filter them out, and you can't urinate. So the water will now be going to your interstitial tissues, your eye, your stomach, your leg, your lungs, and it adds a lot of strain to your heart. So please, you have to really be disciplined. I know it's hard, but if you're on dialysis, you really need to be disciplined and manage your water intake. I know the next question will be, what will I take? The amount of water will I take? So it's recommended that you take the 75 cl or 50 cl in a day if you're on dialysis, depending on how many times you do dialysis and depending if you're urinating. Now, this recommendation is World Health kidney recommendation, but then it has to do also with all the things you're drinking. If you're drinking pap, everything that is liquid that you're taking will have to be 75 cl in a day. So you see, I have made a video on how to help you limit your water intake if you're on dialysis, because I know this is hard. One of the ways is try to soak on ice or drink very cold water, because it will really quench your thirst, and you won't don't just drink normal cold water because you want to drink more. So it will really quench your thirst and you wouldn't have that appetite to drink a lot. So you just need to be careful of your water intake. Okay, and that ice, you just measure the amount of water in a day. You just measure it and put small in an ice. During the hot weather, when you're thirsty, you just soak on ice to quench your thirst. Okay, and be mindful of all the things you drink. Those are still water. Everything has to be 75 cl or lesser if you can. Okay, so that is all about it. Let me know what your doctor has recommended for you on my comment section. Let me know things so that other people can learn, if you're on dialysis, what is going on with you. And I hope this video you like it. Share. My name is Osmerit again. Make sure you subscribe, like. When you like, it helps the video to go to other people. Okay, have a wonderful day, and you can chat me on my Instagram or my social media, and